All right, so we're excited to be here with healthcarescene.com and a number of executives from the HIMSS group. And so we'd like to start off maybe with a little introduction from all three members. We're going to have a nice casual conversation here today. So how about we start from left to right? We can start with David, then Mary, then Rod. You want to introduce yourselves?
Sure. Hey, John. David Collins, mHIMSS Senior Director. I really appreciate the opportunity to speak with you today. Thank you.
Hey, John. You're Griskewicz here in Connecticut, and I'm Senior Director of Healthcare Information Systems.
Hi, John. I'm Rod Piechowski, Senior Director, Healthcare Information Systems at HIMSS, and I'm based in Chicago.
Excellent. So obviously I'm John Lynn. I'm the founder of healthcarescene.com. I have a number of sites, so we'll be posting this to HIMSS and to my network of sites. So looking forward to talking about the upcoming HIMSS conference, which is just around the corner. So maybe, Rod, we can start with you. Can you give us an idea, some of the numbers of what we're expecting at HIMSS, the number of registered vendors, sessions, things like that?
Sure. Well, last year at HIMSS in Las Vegas, we had about 37,000 people, and I don't know if we're close to that yet. It looks like it's going to be another pretty good year. I think the last number I heard, and Mary, you might have more updated figures on this as far as vendors. I believe we are over 1,000 vendors, so it looks like it'll be another big show. Don't mean to sound like Ed Sullivan.
Rod, we're about 1,200 for the last year.
1,200, okay. Excellent.
1,200. That's up, I think that was 1,100 last year, so it looks like it's going to be a big show. And there's only so much space in New Orleans, I think.
Absolutely.
It is a bit smaller, yes. Go ahead, Mary.
Absolutely.
So, one of the interesting trends that's been happening in healthcare is a lot of the hospitals are buying up the physician practices. Are you seeing a shift in the attendance at HIMSS because of this? Is it more CIO, CTO attendance, or are we still getting a fair number of doctors, or do you have an idea of the breakout of who's attending? Maybe Rod, you want to do that?
I don't know if I have the numbers on that one. If I don't think I can speak to that one, and if I did, I don't know if I could attribute it to hospitals acquiring practices.
Mm-hmm.
So I do know, this is Mary, that I think Rod's last statement as far as why. We do have the same number of professionals and approximately the same amount of clinicians attending the conference this year as we had last year. As far as any change or shift in, the acquisition of hospitals and community-based hospitals or purchasing of physician practices, that's more of a science than an art, and we don't have to get down to that level of detail.
Sure. All right, and just kind of one other question about the HIMSS process in general. Maybe you can give us some insight. Seems like the keynotes this year are pretty politically focused. I mean, you have President Clinton, you have Mostashari. I guess isn't necessarily political, but is a bureaucrat, and then also you have the two, Karl Rove talk about politics, right? And his compadre. So, what's the process you guys go through in choosing this, and what was your thought process in bringing these keynote speakers to HIMSS?
David, why don't you take that? You're closer to the process.
Sure. So I was part of the process last year as we ramped up for HIMSS 13, and our executive management really does take a lead on selection of our keynotes. It's a very thoughtful process, a process that takes several months of discussion. Part of it's based on availability of speakers, but part of it's where is the industry heading? And some of the speakers that we were able to secure this year certainly speak to a couple things. We've got our newly elected president, and given last year was an election year, we've got everything happening with the Affordable Care Act. There's so much at stake right now with the healthcare transformation that having these perspectives on where the industry is going, I think we'll get some good insight from these keynotes. So, the keynotes are a balance between entertainment, quite honestly, and, high-level perspectives that are really valuable and people want to listen to. Bill Clinton, as an example,
Sure.
he speaks all over the place, but he's a great speaker, and people listen to what he's got to say. So.
Yeah, I mean, I don't think I've seen any more excitement for any other keynote in past HIMSS than there's been for President Clinton. I think everyone's going to be attending that
Yeah.
for sure. I heard there's another feature that HIMSS is just starting at this conference called the Meaningful Use Experience. Could you guys tell us a little more about that?
Mary, you want to jump in on that?
Sure. So the meaningful use experience is really just that. We have over 39 vendors that will be participating in this year's experience on the show floor. Whether you're a novice or experienced health information technology professional, we encourage everyone to go through the space. You'll have the opportunity to meet with subject matter experts such as myself and my peers, as well as our members and our expert volunteers. You'll have the opportunity to see live lectures on meaningful use, making sure that you understand the criteria as a provider in order to get that incentive money, to see where you are in the stages, and to talk to vendors of certified products. We've done a really good job in putting together the mixture of vendors that are participating to make sure that we not only have the larger vendors included in the showcase, but we've included those that typically may have a little bit of a harder time purchasing some of this from the show floor, to make sure that all of the voice from the industry is heard and that you will have the opportunity to meet with in one place 39 vendors that are certified to help you achieve the meaningful use incentive.
Very interesting. Will you have some people from ONC or CMS to be doing it, or?
Well, the program was actually put in place. Our Office of the National Coordinator, Dr. Piechowski, actually came up with the idea and approached me and said, wouldn't it be a wonderful opportunity? So this is in partnership with ONC at the suggestion that we bring this to our members. And ONC, as always, depending on their schedule, will be participating and going through the showcase. I can't tell you Dr. Piechowski's exact schedule, but I know that he and Judy Murphy, the deputy, will be participating and going through the showcase.
Sure, I know. In the past couple of years that at HIMSS there's been a whole section of government sessions, government events. So it sounds like they're going to be heavily involved again, which goes back to all the regulations that we were talking about.
Absolutely.
So, yeah. So another thing that's been there for, and maybe you can tell me how many years the interoperability showcase has been going on. But it's been going on for a number of years where they've showcased interoperability, but it still feels like there's something like holding us back from like really starting to share data. I mean, it's been proven. Are we going to see some advancements this year, or is it kind of more of the same?
I think this year, I think there will be some advancements. We have some unique profiles, in particular if you look at meaningful use stage 2. We're now saying we have to get engaging the patients and the families. It's no longer just about the providers, so you'll see some profiles there. You'll see the inclusion of the project direct profiles that have been very successful, in particular for the medium and small size practices, in order for them to report on meaningful use. You'll continue to see profiles. To answer your initial questions on, one thing that I hear all the time is, why can't healthcare be like banking? The banking transaction is about 250 data points, okay? The typical healthcare transaction, and think about how unique each individual is over 250,000 data points. And the difference in healthcare is all of our data points are not that discrete. So we continue our work. We've done the showcase for a number of years. We continue to make progress, and it is definitely one of our top projects for the year. And interoperability, as you've seen taken up by HHS and the Office of the National Coordinator, is in the forefront of things, and we will continue to make it do so.
Yeah, there's no doubt the government is interested in making interoperability happen. So I think it's interesting, this movement to kind of shows within the shows or experiences within the shows with the meaningful use experience, the interoperability showcase. And David, I was wondering. I mean, since you do so much mHealth stuff, and I know I met with you at mHealth Summit, and then at CES, I saw this explosion of devices. You know, wristbands, clip-ons, strap-ons, shirts, underwear. You know, who knows what they're going to come out with next, right? To monitor. You know, do you see a kind of wearable device showcase, or any thoughts on that?
Yeah, you know, that's an interesting thought, and there's definitely potential for something like that. I think that the field is going to kind of level itself out. As you saw at CES, there was just a numerous amount of sensing technology, um, and I think that's a good thing. That's promoting health, it's promoting wellness. But what's going to stick to the wall? Who's going to follow through on that? How's the data actually going to be captured and used? I think some of that's going to kind of work itself out first before, you know, we'll see a show within a show dedicated to that type of technology. Now, consumer focus and patient focus and the use of technology to communicate with their provider, yes, I do see that coming down the pike. And Mary, I think I'm stepping into your turf if you want to jump in there and add to that.
So, John, to your point, the HIMSS Board of Directors has identified consumer health as something for HIMSS to explore. And I'm in the process right now of working with our members and trying to gain the voice of our members. We will be doing that at the annual conference. We've invited some special guests to come and talk to us about this. We want to hear from the industry. We want to hear what directions do they feel that health information technology has and should be playing in consumer health. Again, if you look at meaningful use stage 2, it's just the beginning of the call-out, kind of that stepping stone of engaging the consumer in their healthcare. This morning I watched on Good Morning America Mrs. Obama, and she was actually with one of her White House chefs, and they were talking about creating healthy meals and get moving and getting the United States moving towards becoming a more healthier nation. We are starting to see more and more interest from our members and the providers in this area, and we are in the process of exploring this. And I encourage any of our members that are interested in this topic to please contact me. I'll be glad to discuss it with them further.
That's great. So it sounds like you're kind of creating a whole patient consumer experience, kind of looking towards 2014. Are there things that patients can experience if they come to in 2013 next week?
Next week, I think what we're doing is we're monitoring the industry. We'll be listening to our members.
Okay.
So the vendors will have their solutions and their devices and their gadgets, as David indicated, whether they're mobile or not. What we want to hear from is the industry, and we even use our own exhibit floor to see what the buzz is. What are the members interested in? And because that's really where the rubber hits the road. What are the providers, the large providers and the small providers, really looking for solutions on? And what are the practical solutions that work? HIMSS, as you know, from a content perspective, we're all about best practices and lessons learned, and we're more about the practical. So we want to hear from our members, you know, what is working out there, what isn't working. It's great to have all these devices and gadgets, but at the end of the day, if they're not really realizing wellness or health or helping the providers, again, think about those 250,000 data points. Does a pediatrician need the mom to really send them every single data point on their child, or only what they need to treat them? So it's something we need to think about.
That's a good question.
And I would add too that on the topic of the devices, during HitX.0 on Tuesday and Wednesday, we will have a couple of actual organizations showing these types of things. One is a clothing that integrates certain types of sensors, and then there's another organization that will be showing of miniaturized sensors that you can actually wear. They're flexible, you wear them on your skin, and they can transmit data, and that's very much a wave of the future as well. So we'll have that at HitX.0.
Yeah, that sounds good. Are there a lot of device companies that are going to be on the floor? I mean, do they see HIMSS as a good option, or are they more interested in the mHealth Summit and CES?
Well, I was at mHealth and at CES, and I would think currently you'll see much more of those devices at those two conferences than you will at HIMSS, but it's just a matter of time before they starting to connect those devices to the type of operations and systems that you see at HIMSS more typically. So there's a gap right now between what people are gathering in their personal lives, those types of sensors, and how does it connect back to the personal health record or to their longitudinal health record.
Yeah, I would tend to agree with that as well. I've said those shows, and I think that's a showcase for new devices, new toys, and so should see more of that probably at HIMSS 14. Then we'll see some at HIMSS 13. But, there's 152 self-identified mobile vendors on the floor for HIMSS 13, so that might give you some perspective of the 1,200 vendors. 152 call themselves mobile.
That's interesting. And there's always been that discussion of, well, we have mobile health, but we have healthcare IT, and shouldn't they just be the same? Like, I mean, are you seeing that? I mean, kind of your number describes that it's kind of the case.
Yeah, well, a senior director of mHIMSS, the mobile initiative at HIMSS, I don't think there is any other type of healthcare activity going on in the healthcare space anymore outside of mobile. I'm not sure if Mary and Rod have any other opinions, but
you're an outlier.
This is certainly an emerging area that we've really seen an explosion over the last 3 to 5 years. Year 5 is coming up this December for mHealth Summit, and it's grown tremendously. mHealth Summit, in fact, 3 years ago had less than 1,000 in attendance. This last year had almost 4,000 in attendance. So just over 4,000. So I think what I'm learning is kind of meaningful use still has reign because there is incentive dollars that are attached to that, and of course people are paying attention. But the demand for mHealth and mobile technology is happening simultaneously, and providers, ironically, compared to in the past with Health IT, are actually driving a lot of this, as well as consumers. So I see parallel tracks happening between traditional Health IT and what we're calling the new state of Health IT. I think the two worlds are going to merge, and I think we'll see more of this over the next 3 or 4 years, where mobile is just going to be just more part of the synergistic way of delivering care. It's not going to be this new wow phenomena. It's going to be, yeah, we practice medicine. We've got tablets. We've got smartphones. Yeah, this is sensing technology. Yeah, this isn't a big deal anymore. So.
And do you see the mobile going across with doctors, with hospitals, with consumers? I mean, is it just across the entire spectrum, or do you see adoption higher in one area or more progressive in one area?
Necessity is the mother of all invention. That's kind of where I see mobile being most impactful in the beginning. Telehealth is still exploding. 13 states have reimbursement that it has been approved. So that gives you a little bit of a benchmark, 13 of our 50 states. So there's still a lot of what is telehealth. Telehealth itself is evolving as a definition. mHealth as a how do you define mHealth? It depends on your perspective between remote monitoring, use of apps, medical devices, wellness, etc. So I think that, yes, I think we're going to continue to see that drive. And I don't know. I almost see an equal push between providers and consumers. Mary, I don't know if you have a different perspective. Or
consumers actually outpace providers at this point in time. So we're continuing to watch consumers use their apps, not so much for healthcare, but just in general. And healthcare is defined by the consumer a little bit differently. Is there a provider or product? Consumers define it as their physical health, their mental, emotional health, their looks, to be honest with you, and their financial health. So the definition of health is changing now. And so as the consumers consider that, and we move away from the model of Marcus Welby into our whole wellness, we're starting to see the mobile apps take, the center stage. And the consumers are using these regardless whether the clinicians approve them or, prescribe them or not. They're kind of like right past the providers and saying, walking into the office saying, okay, here are all my scripts, this is what I have, this is what I've been doing, and the provider looks with them and goes, oh. Sometimes they'll be asking, certain consumers will be asking, what's the lifetime of the drug, and the consumer will look it up right in front of the provider. So we're starting to see those changes. I was just in Yale New Haven Hospital a week ago, and they just went live with one of their large EHR systems. And it was funny to see the nurse's station is no longer the way it is anymore. It is on tablets, and it is in the hallway. They don't hang out at the central location. They're roaming all over the place. But those docs are hiding in the chart room behind the PCs, and I want to see them on their mobile devices and those tablets in the room. So we still have to work on them a little bit.
So you've got demand coming from both sides, both from the providers and from the patients, and it drives that need to react to that, but the way you treat it is different based on the type of demand. So your considerations are different. If you have providers, if you have docs and nurses that want to use mobile devices, the things a hospital has to think about in order to enable that and accommodate that demand, they're very different than the kind of things you have to think about if it's a patient saying, I want to get a hold of my data and I want to be able to interact with your institution using my mobile device. And that's a lot of what healthcare organizations are trying to grapple with right now. So providing it for your docs and your nurses is one thing. But then how does that data get controlled and protected, and how do you interact with the actual patient? That's becoming a big deal. We've done a couple of educational sessions on that, and they've been very well attended. There's a lot of interest in that area right now.
Yeah, it's interesting that doctors are using the mobile health, right? I mean, we know they're on their phone. They've been using it since Hippocrates first hit the Palm Pilot, right? I mean, they've been using it for a long time, and we know that patients have been searching Google for a long time. It's the third most searched thing, something like that, health information. But it's interesting that we haven't connected those two, so that my doctor is providing me information and we're using it. I mean, maybe that's the next step, I guess.
It is, John, and I think it's some of the problems with the incentives. The doctor, typical physician, sees you for 15 minutes, right, for a wellness visit or of a cold. And are they incentivized for any more than the 15 minutes? So how much of that data are you going to be sending to them? So looking at the portals, looking at a safe point, bring your own device. When I was in Yale, I had to sign what I call my good policy. Basically checking off the box while I did my own device. I had a laptop and a cell phone. I went in on their network, and I had a promise that I would be good and I would adhere to all their policies. So their IT shop, as well as their CIOs, as well as all hospitals across the United States, have to think about this. How they are still responsible, and they must adhere to HIPAA. And as consumers continue to share the data, they need to understand what those risks are and how do you keep that patient health information secure.
Yeah. So I've heard someone defined that HIMSS 13 might be the HIMSS of big data. That finally big data hits the stage at HIMSS. Have you seen this? And are there some things that could indicate we're going to have a lot of big data talk at HIMSS?
Yeah. I'm responsible not only for consumer, but and business intelligence. So we will be doing a couple of things. On Sunday, we will have our clinical and business intelligence symposia. At the same time, in conjunction and partnership with the Data Warehouse Institute, we will be having a workshop on data warehouses. So if you want the bigger picture, the symposia all day Sunday will actually give you the DMAC process of process approach, governance all the way to managing your data, analyzing your data. We're starting with Dave Garrett opening the session, and we're ending with Don Glasser, the CIO for Siemens, as our bookends, as we like to call them, with presentations in between. We will be having a clinical and business intelligence knowledge center on our exhibit floor where we have a host of, I can tell you, I believe it's over 12 or 14 sessions. The knowledge center will also have vendors. We sold that right out. The vendors are very excited for being there. As well as throughout the conference, we have a host of sessions by IBM and others on the show floor talking about how data can be realized using big data, managing data, and what to do with the data. You know, as we know, data warehouses have been around a really long time. The issue is now that we have meaningful use, what are you going to do with the data? So you need to be using it for healthcare transformation, for accountable care organizations, for reporting to HHS and CMS so you can get that incentive money. And that's truly, whether you call it big data, small data, it's the management and the value of the data that counts. And you're going to see that throughout the stuff.
Nice. Well, we'll be looking for all the big data. It sounds like tons of sessions. So I mean, we've kind of talked about a number of trends. I mean, there's obviously meaningful use. There's the mobile health, the big data. But you know, as I look at the healthcare IT shifts, if you look from HIMSS to HIMSS, you often don't see the major cultural shifts that really are happening. So I think it usually takes a couple of years. You know, I often say, what's going to happen in 5 years? That's when we'll see a major shift. So you know, what are the shifts that you guys think we'll see getting started at HIMSS 13 that 5 years from now we'll be like, wow, you know, this is so much bigger, but it started back in 2013. Rod, you want to start?
Well, I would start out exactly with what Mary just talked about, with the idea of now what do we do with this data now that we have it? What's the responsible way to use it? How can you use it for internal betterment of your processes? We're finding that there's a lot more interest now in process improvement itself. We're hearing that how do we go about doing this? So now it's becoming more about the art of how do you employ technology and make the most of it, and what do you do with the data? What can you learn from it? Not only about your organization and how you efficiently provide healthcare, but what can you learn about the provision of healthcare and medicine as we start to aggregate more information? So I think you'll start to see a lot more of that, because as meaningful use becomes less of a future and more of a reality, everyone will have this information or the ability to gather the information, and you'll start to see a lot more discussion and some creative thinking about what we're going to do with all of it. And I think people have some pretty good ideas of where they'd like to see it get to. How they get there will be a matter of, again, innovation. You know, one of the areas that I work with is the Innovation Committee and the Innovation Community here at HIMSS, and this is an area of huge interest. We just started this last July, actually, officially, and we have almost 5,000 people as a member of this community interested in the idea of innovation. And they're not necessarily all innovators, but they are looking for other proven ways that other people have discovered to provide higher quality care at a lower cost. And so you're seeing more of an exchange of ideas among organizations that maybe wouldn't have shared information previously, because they've had some good experiences, and now they're able to say, hey, this really worked for us, we saved a lot of money, and we improved the health of our community.
Yeah, I think you know, I've described it as smart EMR. You know, it's kind of the Watsonizing of it. You know, bringing in all the, you know, you have all this data. Now, what do you do with it? How do you make it smart rather than just a big data repository? I think that's a good one. Any others that you have in mind? Do you have some mobile ones for us, David?
Yeah, absolutely. I think as I described before, I think mobile will be evolving. It'll be more streamlined, integrated into the traditional, EHR systems. Uh, you know, Interesting enough, as Rob mentioned at the HitXO sessions this year, we'll have some more sensing technology showcased. We touched on that a little bit last year. We also have Ford Motor Company there that's talking about the car that cares, sensing technology built into the car itself, and it monitors, the atmosphere. And if you've got asthma, other challenges, your car is actually going to interact with you. I think we're going to see mobile care more pervasive, more integrated. I think that cost and quality are going to drive a lot of mobile care. Um, I might be stating the obvious, but with our new care models that are, through ACOs and PCMH, I think mobile is certainly a tool that's going to be leveraged to drive those efficiencies, to get those cost savings, to get the speedier access to care. So I think that mobile is going to be more and more part of the traditional today's what we call the traditional solution is going to be the new traditional solution. It's like, yeah, well, part of our integrated suite includes you know these certain mobile devices. So
So what you're saying is we should have a Ford Mustang experience at the next HIMSS where we can drive around while they monitor our body. I like it.
What a raptor.
Yeah, that would work too. So, Mary, how about some things for patients? Any things that starts to shift of that?
Yeah, so this year we are starting the shift, John, to go back to your previous question. We are having on Tuesday, I call Tuesday the patient day. So
Okay.
we are doing a forum on the patient experience through health information technology. Start with a session on meaningful use, and then we talk about the actual business cases for the provider and patients. Why do you want to use health information technology, whether it's mobile technology, a laptop, or virtual television, right? The interactive television that's going to be coming. So leading from today to tomorrow, what is that going to be? And then actually, we're closing this session with looking at some of those technologies that are being put in place today. I see us doing more around consumer health, including the consumer, and doing what you said before, matching the providers and the consumers so they can share that data. The data is only as good as the validity of the data, whether it comes from the patient or from the provider. So really getting people to work together for wellness and healthcare in order to transform the system, to lower those costs. I've started in fee-for-service. I went to capitation. Now I'm in healthcare transformation, whatever this is going to be with ACOs and patient-centered medical home. And it's definitely taking the patient and looking at patient-centeredness and including the patient as the care member of your team. I had this conversation with a recent care coordinator, and I basically said, well, what about the patient, including the patient in your team? You need to include them in the discussion. You need to include them in discharge instructions. Where do they want to go? How do they want to be released? And then once that patient goes home, wow, there's the smart home, right? So what technologies are being enabled there? From the smart refrigerator to the smart fork that you guys saw at CES, right? Gee, I wish I had one of those right now. But, looking at those devices and making sure that the data and the data points are interconnected so that we can all use the big boxes and the computers and teach the Watsons of the world, right? Watson's next challenge right now with Sloan and Cleveland Clinic is they're going to mentor Watson so that Watson understands the patterns and the algorithms, so eventually they can use all that data, siphon through it, right, the personal data, so that hopefully at the point we can match the human genome to get that personalized medicine. And to Rod's point, that's eventually where we need to be. So all of these technologies convening hopefully will help with wellness, better outcomes, and reduce costs at the end of the day.
And the cool thing about this is that healthcare then becomes less of a discrete event and more of something that's integrated into our lives, and that is absolutely because of the kind of technologies that are coming out now and how they're starting to bridge between the EHR systems and all of these other systems. That's what's going to do it.
So you have the hospitals of the future. Now you're going to have the homes of the future with the integrated health. I mean, I actually have a blog post that I'm waiting to write that says, "Can your TV make you healthier?" Which I think, you know, hits that kind of idea, right? And you could have a home with a TV, and how could your TV make you healthier? And then you get out to your Ford car and you drive it around and see healthy. I'm seeing an experience coming right here. Very, very interesting. So I imagine with you guys working at HIMSS, you've been thinking about HIMSS constantly for the last couple months. I mean, probably since the last HIMSS. So, you know, what are you most excited to see at the upcoming HIMSS? Maybe start with you, David.
Yeah, absolutely. You know, there's so many different things going on at HIMSS. One thing that I'm kind of excited to see is our Leading from the Future program on Sunday. That program has, I think, come together really well, and it's the delivering on value, you know, where cost and quality meet, and it's basically addressing the cost-quality curve. And I think, you know, hence the title of the program, Leading from the Future. How is the cost conundrum being managed, and how do you stay competitive in this very high cost environment, and, you know, be a provider of choice, provide good quality, and, you know, be competitive, keep doors open. I think value is key, and value is certainly where I think we'll continue to see HIMSS conferences go in the future as well. It's not just the parts and the pieces and the gadgets and the technology, but it's also, you know, how is this making care better, and why, and, you know, and moving from the sickness model to the wellness model. So that's going to be a neat program in the sense that we're doing something a little non-traditional. In the morning we'll have our traditional lectures, but in the afternoon we have what we call ACO encounters, and we're going to have you know, a physician perspective, a hospital perspective, and a payer perspective, and people will actually get to rotate through and learn from successful models, best practices, and barriers and challenges. See, I surprised you. I didn't say mobile. I was going to say all these different mobile things. I'm excited about those too. So.
That's good. So how about you, Mary? What are you looking forward to?
So, two things. For the conference, it's definitely the Clinical and Business Intelligence Symposia. I think our members, some of them are still struggling with, you know, I have these data warehouses and data marts, and how do I make sense of the information? My passion really is with the patient experience, and really getting that data together with the patients and the provider. So I think Tuesday for me is a big day. We're also having Regina Holiday, artist and patient advocate, hanging at all three of the sessions, and we're ending with a tweet up from 3:30 to 4:30 in our social media center. So it allows our social members on social media, as well as those speaking live, to get together. We've invited the Officer National Coordinator, NEHIC, to participate, the Society for Participatory Medicine. We're launching a brand new book called Engage that Jan Oldenburg from Aetna has edited for us with several of our members, and it's about that. It's why should providers include the patients as part of the care model and use information technology in that process. So I'm really excited and passionate about that. So Tuesday for me will be the big day.
Excellent. And you, Rod?
Sure. Well, it's always exciting to get out on the floor and talk to people and hear what people have to say and what they think, and see all the hardware and the software. But I think you can tell from what Mary and David have said that there's, you know, we feel there's a lot more to it than that with the educational sessions. And I'm going to have to lean for the Innovation Symposium on Sunday. That's really going to be pretty cool. What we've done is we've designed a day that's all about the science and the practice of innovation. What is it? Our opening keynote is Bob Eckert, who's the CEO of an organization called New and Improved. And, you know, this is they help people all over the world figure out new ways of doing things, how to engage your employees to reinvent processes and workflows. And that's really what a lot of healthcare is facing right now, is the introduction of information technology doesn't solve all of these problems, but it gives you a tool that allows you to do all new types of things in much more efficient, creative ways. So we're going to be looking at that process, how you create an innovative atmosphere, how you keep it going, how do you create a culture of innovation within your organization, and what are some of the tools you can use to do that. And then at the end of the day, Jonathan Teisch is going to wrap it up for us, and he's going to take a look at the future of innovation in healthcare and just try and put everything together for us. So I'm really looking forward to that. And just seeing everybody wander around, and it's so great to hear what people have to say. I take so much away from these conferences after having just 60-second, 2-minute conversations with people about what interests them, what intrigues them, what frustrates them, and that helps us put together our strategies for the coming year.
Yeah. No, I mean, absolutely. I think everyone agrees that usually the best part of the conference is the people. So if you can meet the right people, then it usually works out, and the rest is the icing. And I think the events and the programming brings people together around certain topic areas, which is interesting. So I'll go ahead, Mary.
Speaking of people, David, myself, and Rod will be at an event with all of the content experts with HIMSS on Monday evening, and it's called the Community's Open House. So that's an opportunity, and it's a reception. The first half hour is for new members. The second hour is for existing members that are involved in many of our communities, task forces, and work groups. And it's an opportunity for all members to come and meet and greet with us and other content experts. And I encourage you, as well as all of our members, to come and participate in that and talk to one another and network. And as Rod said, tell us, what do you like? What don't you like? What would you like to see next year? You need to tell us so we can bring it forward for you and me.
That's great. And I know that there's a lot of people who can't make it to HIMSS, right? Imagine that. I think, what if we're at 35,000, how many healthcare IT professionals? Well, there's probably 700,000 doctors that, so there's a lot that can't make it. So, what are the options if they want to follow along at home? I know you have a few different options.
Sure, I'll jump in there. So last year we piloted, we had the inaugural launch of, HIMSS virtual, and we learned some lessons from that, and we kept it and modified it for this year, and so folks can actually hear the keynotes live, which will be video streamed. So that's kind of a cool option, as we'll have some exceptional keynotes, as you pointed out in the beginning of the conversation. And they will have access to on-demand sessions and certain select other sessions that will be included as part of that overall package. So it is really a good opportunity to experience the education and the buzz, the hot topics, if you're not actually able to go there and spend time. And we started this whole concept 2 years ago because we realized not everybody can go. Not everybody gets budget to go. Someone's got to stay behind and actually run the hospital, right? And then there, of course, will be lots of blog pieces that we're actually having our volunteers. We're requesting them to blog about their experience on the floor. Our social media, our digital pavilion will be doing all kinds of Twitter chats, tweet ups. I think last year was the most. The HIMSS had the highest number of tweets ever sent out from a healthcare conference. Set a record, so expect the same this year. So there's a way to plug in and feel included, and of course everything will be recorded and can purchase that after the conference if you want to hear specific sessions that you want to learn more about.
Excellent. I'm glad you threw in the social media. I'm sure Michael and Carrie will be happy. It's going to be a highly tweeted event. I am certain of this. And as actually, it's one of my favorite parts, obviously, as a social media person. So we'll be covering it on healthcarescene.com as well, so people can check that. Any final thoughts before we wrap up?
Well, remember, John, it is New Orleans, so I hope everybody has a wonderful time. It will be a great party on the floor and off the floor. But more importantly, we hope our members get value from everything that we bring to you, whether it's networking, education, opportunity to learn, to grow, to develop professionally. We have some wonderful professional development opportunities as well. I look forward to meeting and greeting as many people as I potentially can. And our information is always available on our website as well. So if you can't make conference, please send us a tweet, an email, Google circle us, and we'll be glad to let you belong in your circle as well. So thank you, John, for doing
Yeah,
And I would only, go ahead.
Go ahead, Rod.
I was just going to say, I would only add that one of the best places to run into any of us throughout the day would be at HIMSS Central. There'll always be somebody there, and if you're looking for someone specific, we can always get you connected, help find that person for you, but there will always be staffers there, and it's a great place to hear what's going on and chat with some of the staff and learn way more about what's going on at HIMSS.
And I'll tag right onto that. Right across from HIMSS Central for the first time is going to be a mHIMSS booth. So that gives you an opportunity to come learn more about the mobile initiative of HIMSS. We'll actually have a tweet up there in terms of talking social media on Tuesday from 3 to 4. So that really gives the opportunity for people to meet face to face and network. And we're going to have the topic of the tweet of actually mHealth Innovators Collaborative, and this is an idea for fiscal year 14, bringing stakeholders together and sharing lessons learned, so you don't have to reinvent the wheel, and bringing everyone from CIOs, CMIOs, CTOs together with developers, entrepreneurs, and mixing the crowd and understanding the needs that are driving mHealth. So that should be fun.
Excellent. Well, I appreciate you all taking the time, and I think you're a good representation of the people at HIMSS that I've met that really care about the industry, care about your members, want to bring something of value and improve healthcare. And hopefully we'll see that at HIMSS, along with I want some beignets and some nice music. So that's in the evening, that's what I'm going for. So thanks so much for doing this.
Thank you.